Hello and welcome to the Northwest Community Health EMS Education Program EMT Open Enrollment presentation. My name is Tyler, an instructor with Northwest Community Health.
And I'm Judith, also an instructor. Over the next few minutes, we are going to discuss some important information that you, as prospective students, need to know. Let's get started.
Northwest Community Health is officially called Harris County Emergency Services District Number 8. Our education team is here to ensure that your education experience is superior. Dr. Brian Bayani is the Chief of EMS and our Program Director, and some of the more common senior faculty you may regularly see are Eric Steffel, the Director of Clinical Practice, Jonathan Coyle, the Clinical Educator, and Valerie Rosa-Lasordo, our primary EMT instructor.
The Emergency Medical Technician course is an introductory level course in pre-hospital emergency medicine. The course will discuss topics in medical terminology, pharmacology, human anatomy and physiology, as well as patient assessment and EMS operations. At the successful completion of the course, students will be eligible to attempt the National Registry written exam to obtain their certification.
The EMT class is about 14 weeks long, meeting once a week and typically every other Saturday. In addition to the class days, students will complete a total of 24 hours of hospital clinicals and 72 hours of ambulance clinicals. These hours are scheduled separately from class time. Students are not permitted to miss a class to attend a clinical.
The Emergency Medical Technician course is similar in difficulty to what you would see in a 100 or 200 level course in a college setting. This course operates in a flipped classroom format. Students will complete interactive lecture, assignments, and assessments online prior to coming to class. While in class, students will then put what they have learned into practice by participating in hands-on activities, as well as other activities, to reinforce what they have learned.
It is important to know that this program has high academic standards. For each module exam, students must achieve a score of at least 70%. Students who score less than 70%, but above 50%, will be allowed to retake the exam once. If the student achieves a score of at least 70% on their retake, only a maximum score of 70% will be recorded in the gradebook. Students who are unable to achieve the 70% score on their reattempt will be considered academically unsuccessful and will be removed from the program. High school students are permitted to retest 2 exams. Adult course students are only permitted to retest 1 exam. Students who score less than 50% on any module exam will be removed from the program.
The Emergency Medical Technician course is approved by the Texas Department of State Health Services and meets or exceeds all EMS education standards. At the conclusion of the course, students will be eligible to test for their National Registry certification. This consists of 2 parts. The first being that the student successfully completes their skills evaluation. This is included as part of the course. The second being that they successfully pass the National Registry of Emergency Medical Technicians cognitive exam. Once a student has their National Registry certification, they can then apply for their Texas EMT certification. EMTs must be certified by the state of Texas in order to work as an emergency medical technician.
To be eligible for enrollment, students must be at least 17 years old by the first day of class. You will also need to have a high school diploma or GED. To satisfy this requirement, the program will also accept high school or college transcripts so long as they indicate high school graduation. Because this course relies heavily on the use of technology, basic computer usage skills are required.
During enrollment, students will undergo a criminal background check conducted by the program. Students with a misdemeanor or felony conviction noted on their background will be required to receive an approved pre-enrollment petition conducted by the Texas Department of State Health Services. Contact the program if you have additional questions about this. Students will be provided instructions on when and where to complete their urine drug test. This test is included as part of the adult course tuition. High school students should speak with their instructor to receive directions on completing their drug test.
Our clinical sites require documentation of a physical exam and proof of vaccination. We will talk about that more here in a few minutes.
Finally, students must complete all of the enrollment documents that are required by the program. These are issued to the student's portal after they apply to the program.
We are excited to announce that all of our future adult EMT courses will be held at our new Administration and Education building, located at 29510 Quinn Road. This building is fully equipped with classroom and lab space. Please also feel free to stop by and speak with our education staff if you have more questions about the program. Our office hours are Monday through Friday, 8 a.m. to 4 p.m. For our high school courses, please speak with your school administration to find out when and where your class will meet.
We offer a competitive price for the cost of our EMT course. The tuition amount of $1,500 includes your course tuition and fees, your textbook and online platform access, as well as your uniform shirt and your first attempt at your National Registry written exam. To secure your spot in the course, a non-refundable deposit of $650 is required at the time of your application. The remaining balance will then be due by the first day of class. High school students will have a different cost depending on the agreement between Northwest Community Health and your school. Speak with your school administration to find out what your cost will be for the course.
For your convenience, we also offer a payment plan. This plan has an administrative charge of $60. If a student does not make their payment by the due date, they will be charged a late fee and not be able to participate in class until the amount is paid. Additionally, a line of credit option is available through Afterpay. This option is selectable as a payment option when you pay your tuition. Please know that credit card and debit card transactions may incur an automatic 3% fee.
In addition to the course tuition, students may have some additional out-of-pocket costs, depending on their situation. While the course provides the uniform shirt as part of their tuition, students will be responsible for providing the other parts of their uniform, such as pants, belt, and boots. We will talk about uniform standards here in a few moments. As part of the class, students will need to provide their own adult manual BP cuff and stethoscope. To assist students with this, we offer a clinical kit for sale. This kit is completely optional. However, it does include a quality BP cuff and stethoscope, trauma shears, safety glasses, O2 wrench, and a pen light. The cost of the kit is $65. There is also an added option of adding a blue or black program backpack. The backpack with clinical kit is $90. Students will have the option to order or decline this item when they enroll in the course.
Once the class is completed, there are additional costs associated with obtaining your Texas EMT certification, like your application fee and your fingerprint processing fee. For every class and clinical, students will be required to be in full uniform. High school course students will be advised by their instructor on what days they need to wear their uniform to class. However, they still must wear their uniform to all clinicals. The program provides the uniform shirt and the photo ID badge. Students must also wear black work-style pants, boots with above-the-ankle support, a plain black belt, and a black undershirt. These items do not have to be elaborate or expensive. Once enrolled, your instructor can provide you recommendations for uniform items for various price points. Nearly all of these items can be found at major local stores like Walmart or Academy Sports and Outdoors. Jeans, leggings, and scrubs are not permitted while in uniform. All students, regardless of their gender, must wear a crew neck style undershirt.
For cold or other inclement weather, students can wear a jacket. These need to be plain black, blue, or reflective. While a small visible manufacturer slogan is acceptable, there should be no other large-sized slogans or decor on the jacket. Students who are affiliated with other departments that wear uniforms, like police or fire departments, cannot wear any attire that has their department name or logo on it.
Students are not permitted to wear shorts while in uniform. Facial hair must be well trimmed and neat. It is critical that facial hair not prevent the student from appropriately wearing an N95 mask.
Unnaturally colored hair and extreme hairstyles do not present an appropriate professional appearance and are not permitted. Students with long hair must have their hair pulled back off the face and neck so as not to interfere with patient care or safety. Good personal hygiene is important in the workplace. Strong body odors or body sprays can actually impact a patient who is already sick. Jewelry must also be professionally appropriate and not interfere with job functions. Only one stud-type earring is permitted per ear. Hoops or dangling earrings are a safety hazard. In addition, facial or tongue jewelry is not permitted. Students may use a clear spacer for extra piercings. Only one ring per hand is permitted, and it cannot be a design that can cause a breach while wearing gloves. Also, natural or artificial nails must be a uniform neutral color and not extend more than 1/4 inch past the tip of the finger. Coffin or almond tips are not permitted.
Now let's talk about the medical documents that are required for the program. As we indicated earlier, our clinical sites require proof of certain vaccinations. These vaccinations include measles, mumps, and rubella, a 2-shot series, hepatitis B, a 3-shot series, varicella, a 2-shot series, a tetanus, diphtheria, and pertussis vaccine every 10 years, and the current year influenza vaccine. For the MMR, hepatitis B, and varicella, a serology, also known as a titer, can be substituted. This is a blood test conducted by your healthcare provider that tests for the presence of immunity to the specific disease. If students choose to have the serology done, and the results come back as not immune, then they will need to begin the vaccine series and remain on schedule in order to participate in clinicals. You should also know that the varicella vaccine is the vaccination against chickenpox. A history of having chickenpox does not substitute for getting the vaccine or titer. The COVID-19 vaccine is not required to participate in clinicals.
Students must have a physical completed within the last 12 months. This can be any standard, work, school, or sports physical.
Finally, students must have a TB skin test completed within the last 12 months. For students who test positive or know they will test positive for the TB skin test, they can have a chest X-ray completed to verify there is no active tuberculosis infection. Northwest Community Health does offer the TB test for an additional fee. Contact the program if you want to schedule an appointment. All medical documents will be uploaded through the student's portal. Each document must clearly indicate the student's name, the vaccine being administered or the exam being performed, the date it was performed, and the healthcare provider who performed it.
So what happens now? If you are interested in enrolling in the course, scan the code on the screen to be taken to our online application. We only accept applications during the open enrollment period. So if you submit an application while enrollment is closed, don't worry. We will place you on our interest list and let you know when we start accepting applications for our next class. Once you submit your application, you will receive your tuition invoice to your student portal within 5 business days. Remember, you have to pay at least the $650 deposit to hold your spot in class. After that, it's a matter of gathering all of your medical records and uploading them to your student portal. Once you enroll, you should expect to receive regular email communication from your instructor with additional information about preparing for class.
Thank you for taking the time to learn about the Emergency Medical Technician program at Northwest Community Health. We know this was a lot of information, so feel free to rewatch this video as many times as you want, or email us with any questions at education@hcesd8.com.
We look forward to seeing you in class.